All right, we are live once again this week with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you for joining us again today.
Thank you for having me on this Orange Shirt Day.
Orange Shirt Day it is. Today is Orange Shirt Day, raising awareness for residential schools in Canada and their legacy within our country. So thank you, Doctor, for participating as well. We are going to get started with your COVID-19 questions today. My name is Dilshad Burman. I am a web writer and reporter for City News and 680 News. We've been getting questions all week from our listeners and viewers. And if you haven't had a chance to submit your questions, you can still do so underneath this live broadcast, and we'll try and get to as many as we can. So let's get started, Doctor.
Let's go.
All righty. So we'll start with, we've got a mixed bag of questions this week, so we're just going to get started. First, let's get one from Suzanne. She says, what should we expect for wave 2 that is different than when this virus first got here back in March? And do non-COVID believers or non-maskers pose a risk to the general public in terms of the second wave?
Okay, so we've actually learned a lot getting into wave 2 compared to wave 1. In wave 1, you remember, like, it was March, and we actually just kind of learned about the virus at the end of December. We had our first case in January, but now we've actually gone through it, and we actually know what public health measures work. We know that if we keep people at home, actually we can slow the spread of the virus, but we don't want to keep people at home necessarily. So things like physical distancing, wearing a mask, all of those things that we've talked about, we know work. And so I think that's what's going to help us getting into the second wave. We also have a better sense of how to keep COVID out of long-term care homes, how to protect our most vulnerable. And that's probably one of the most important things that we can do in wave 2. Getting flu vaccinated is going to be one of those things. I think there's no question that we're seeing the rise in cases that we're seeing. 55% of our cases in the last month in Toronto have been in those aged 20 to 39. And we know that much of it is related to not following the precautions completely. And so following the precautions is definitely something that we need to do. We need to encourage each other to wear a mask, to keep that distance, so that we can be able to get further in the second wave compared to the first.
Right. And then Amy asks, given that this second wave is pretty much here now, should we be canceling all Thanksgiving get-togethers with people outside of our regular home unit?
So that is something that I would recommend now. We are recommending that you stay with your household. And so the concept of the social bubble or the social circle, really we have to move beyond that now. And because of the rise in cases, in order to get a handle on it, keep close contact with people you live with, and anyone else, keep that physical distance. Now, you can still get together for Thanksgiving, but I would suggest do it outdoors and have a very small gathering and keep that physical distance. Even better, though, I would say maybe make some turkey, hand it out, and then eat together virtually. As you know, let's do things safer just so that we can, it's different. We want to give thanks, but let's find a safer way to give thanks together.
Absolutely. And then Aaron asks, TTC crowding does not follow the 1 meter physical distance guidelines when wearing masks. Why does TPH continue to allow it to run this way?
So we recognize that there are certain things that happen in our day-to-day life that make it difficult for us to maintain a physical distance. And that's why we say as much as possible, maintain that distance. And especially when it's not possible, and in indoor settings and on transit, wear that mask. Wash your hands. If people stay home when they're sick, that will also reduce the risk. I think we have to try and see, well, can we take transit on off-peak hours when it's not so busy? Are there other ways for us to get around? Can we work from home part of the time? Is that a possibility? So I think that we have to figure out how we can be safer on transit. We are certainly working with our TTC colleagues to ensure that the transit system is safer.
Right. Joanne asks, if we get the COVID vaccine, which might be 60 to 70% effective, does that mean that we can still get COVID, but maybe not as severe a reaction, which is kind of similar to the flu vaccine?
So we actually don't know how effective a COVID vaccine is going to be. There have actually been, the phase 3 trials are currently ongoing. This is where they're studying the vaccine in humans. And we don't know how well, maybe it might be 90% effective. Maybe it might be similar to the flu vaccine, 50% effective. We actually don't know. But even if you had a vaccine that was like the flu vaccine, 50% effective, it wouldn't give you 100% protection. And so we would still have to maintain precautions. Sometimes with vaccines, it can give you a milder form of the illness, or that less severe, keep you out of hospital, keep you from dying from the illness. And so that's certainly something to watch for, and could certainly be the case.
Okay. Either way, it's somewhat effective. And I think at this point, we have to take some overall, right? So,
well, right now we have nothing. Right now, there's no vaccine for COVID that's effective at all. And so we have to wait and see. We also want to make sure the vaccine will be safe. And so, but once we have a vaccine and we know what those characteristics of the vaccine are, well, then we're happy to discuss it further then.
Absolutely. Okay, so Ian asks, and we've had questions about this before, but we'll do this again. What is the R number for Ontario and Canada, which is used in many other countries to indicate the infection rate or spread?
Right. So it gives you a sense of if someone gets infected, how many more people are they going to infect? And you actually want, if one person gets infected, they infect less than one person. That's how you actually can reduce the spread of infection. If I get infected and I infect you, well, then the infection will continue to spread. But if I get infected and I infect now, say, 2 other people, well, then things will grow higher. And the R factor right now is above 1. And whenever it's above 1, it means that more people are being infected from a single person who's had the infection. And that's why we're seeing the cases rise.
Okay. We're actually getting a question in right now from our reporter, Faiza Amin. She's asking about contact tracing. It seems that it's difficult to reach close contacts of COVID patients for a number of reasons. Apparently, contact tracers can only reach about 54% of people daily, and they can't really get through to the other 50%. Is that a concern? How are we mitigating that?
So actually for just the previous week, we were actually able to reach more than 90% of contacts within 24 hours. We do have mechanisms in place to reach contacts. So if they're not answering their phone, we could try texting them, we can try alternate numbers. If we still can't reach them, we can actually send them a letter. And the letter says, contact Toronto Public Health for an urgent health matter. And then we can often reach them that way. We could find their next of kin, someone who we can contact to reach them. So we have a lot of tools to be able to reach people, to notify them, to let them know if they were close contact that they need to isolate, for example, or if they were a case, so that we can do that complete investigation. As the cases are rising, there are that many more people to contact. And so there may be some delays in doing some of that contact tracing. But by and large, the vast majority of people are answering us, and I think it's up to everyone, really. Like, please do respond to us, because it's not just for yourself, but it's also to protect others.
Absolutely, yeah, absolutely. And I think a lot of restaurants and places that you're going now, they make you list your contacts and things like that. It is voluntary, but like you said, it's up to us. If you want to make sure that you can be traced back, then you need to give your information, right? And
that's right. And I think that's exactly right. Like we are saying, please do give your information, because it will help with that contact tracing in those situations. And what we want to do is, in those situations, to do contact tracing as quickly as possible.
Absolutely. And then, okay, let's go back to the questions we received. SL asks, if we know that there are 6 other coronaviruses in existence, how does the test differentiate from other coronaviruses? Can this be clarified?
Yeah, so it's actually what we call a molecular test. And so it actually looks at a piece of the gene in this SARS-CoV-2, this particular virus that causes COVID. And that's not present in the other coronaviruses. So that's the test that we're using. There are certainly other tests out there that may cross-react with other coronaviruses, for example, but that's not the test that we're using. And so that's how we can be confident that we're actually catching being able to get the results for SARS-CoV-2, which is the virus that causes COVID-19.
Right. Okay. And then RG Hathaway asks, I guess it's a similar question. He says he's heard that the tests are unable to pinpoint COVID and that PCR testing doesn't work. Can you explain that?
PCR testing actually has proven to be quite good. And if you collect it depends on what kind of sample you collect. Are you collecting the deep nasal or collecting the saliva? Some of that will determine how accurate it is. It will also determine when you're tested. Do you have symptoms when you're tested? Usually it's not as effective if you're testing people who have had no exposure and have had no symptoms. Well, then you're less likely to get a positive result or a true positive result in those situations. But the test itself actually has very good performance and can be quite consistently relied upon.
Okay. And this one is more about long-term care homes and such. Tina asks, personal service workers are to provide care to patients or residents who are stable, she says. Why has it been declared okay by medical officers for them to care for COVID positive people, because COVID positive people are not in a stable condition?
So I think that if you're having concerns about the kind of work that you're doing and you feel that you're not trained to do the kind of work that you're doing, my first suggestion would be to talk to your supervisor about it, talk to the nursing home where you're at. We actually are seeing that some people who have COVID actually have a milder illness, and they're not quite sick. Sometimes it actually just looks like a cold. And so that may be why you're seeing more people who have COVID who are actually still staying in the nursing home or retirement home. It would be treating them as you would if they had another kind of mild viral infection. But again, if you have concerns about the level of care, please do get in touch with your supervisor.
Right, okay. So David asks, I am 80 years old. If I wear an N95 mask and sanitize my hands and maintain distance, can I safely go shopping at a large grocery store?
So David, I would say an N95 mask is probably not going to be more protective to you than an either a medical mask or a cloth mask. N95 masks actually have to be fit tested, so you can't just buy an N95 mask and use it and think it's going to protect you further. You actually have to make sure that it's the right one for your face, because it actually creates a seal. It's actually quite difficult to do daily activities wearing an N95 mask. That being said, I think definitely wearing a mask, keeping your physical distance, washing your hands. You can safely do grocery shopping for sure. I think if we found that grocery shopping was an unsafe thing, we wouldn't have seen, for example, in the summer when we went months with very few cases. Mm-hmm. So but we do have to take precautions. And I think as much as you can keep that distance from others when you're grocery shopping and wear that mask, that will be your best protection.
Okay. This one we've had over the past couple of months, we've had this one come up a lot. This one is just from Anonymous. They ask, in your opinion, is hydrochloroquine effective in fighting COVID? Because it's a word that we've heard being thrown about quite a lot recently.
Right. So hydrochloroquine as a drug is not recommended for COVID, and that has come out from many medical bodies to say that it is not a recommended treatment. Now, if someone has severe COVID, there is actually an antiviral drug that has been approved in Canada that can be used. So there are certainly licensed drugs or treatments that can be used for people who have very sick illness.
But in Canada, we don't recommend hydrochloroquine.
Correct.
Okay. And so now we'll move on to some mask questions. We got quite a few again this week. So firstly, SW asks, is a mask required in Ontario when a salesperson is behind a plexiglass screen?
So according to our Toronto mask bylaw, staff are exempt from wearing a mask if they are behind a physical barrier. So if they're behind a plexiglass screen, so that means, think about if they were to cough, they can't transfer their droplets to you, then they are exempt in the bylaw from wearing a mask.
Okay, that's an important one. And then Jenny asks, within our social bubble of 10, can you confirm if masks should be worn?
So I would say now the answer is yes, because really it's in your household. We're saying you don't need to wear a mask, but now anyone outside of your household that would have included your previous social bubble, you should wear a mask and keep that physical distance.
Right. And as you said, rules are changing all the time. Right now, that's what we're saying. I mean, hopefully the second wave doesn't hit us so hard that we have to shut everything down. But if we take the precautions that we learned about in the first wave, maybe we'll be better off, right?
Yeah, and I think it's important to know that family have spread COVID to family, not even just living in the home, and they didn't intend to. Like, you think, well, they're my, uncle, aunt, cousin, whatever it is, they won't give me COVID. Well, they won't give you COVID on purpose, I'm sure, but if they're contagious, you can spread it 2 days before you have symptoms, and you don't know. So you really don't know, and that's why if you keep that distance and wear that mask, you will be protected.
Absolutely. And then this one is from Anonymous again. What are the legal excuses for mask exemption? Because I'm still seeing a lot of people with no masks, especially employees working in schools. So are there any legal exemptions?
So mask use in school is governed by the school boards and the principal. It's reasonable exceptions for medical reasons. That's the reasons for wearing a mask, for not being able to wear a mask. There are some, if for particular reasons, like human rights reasons or religious reasons, you cannot wear a mask, well, then accommodation can be provided. Again, people who can't wear a mask for other reasons, for whatever the reason is, need to consider what other precautions they can take.
Right, absolutely. And so Wendy, I guess, has a related question then. She says she works in a drugstore and cannot wear a mask for medical reasons. Is it safe for her to be there then if she can't wear a mask?
So I think these are questions that you need to have with your employer. I think the question is, can you not wear any masks, period? Sometimes wearing a medical mask is easier to tolerate than, say, a cloth mask. Sometimes it's about building in mask breaks. Sometimes it might be, a shorter shift. You could have plexiglass up, so you wouldn't have to wear a mask. So I think what you have to do is make sure that there's protection, because as an employee, you should not be going to work and being exposed because you can't wear protection at work. So I think whether it's protection, whether it's a barrier, whether it's other type of work, whether it's talking to your doctor about, are there ways that you could safely wear a mask? I think these are all things that need to be considered.
Absolutely. And then Nana asks, if we are wearing masks to prevent COVID-19 droplets outwardly infecting people, why is the COVID test so invasive? And can't the test just be a nose or mouth test?
So there is now a nose and mouth test available, actually. So, right, the first tests that we had were those deep nasal, they're called nasopharyngeal swabs. Now we're saying that children can actually get a throat swab and just a nostril in each nostril, a swab in each nostril. And saliva testing is actually now available. It's available in 3 assessment centers in Toronto. And by next week, in the next few weeks, will be rolled out more readily to, particularly for children. So less invasive methods of testing are coming. Sometimes it's the nasopharyngeal swab is still what we consider our gold standard. It's still, if you have that swab, you're more likely to detect COVID more often. Sometimes if you do a saliva test, it might be falsely negative. But again, we have to balance, the reasons for getting the test, the ease of getting the test taken, and then the results or the test characteristics.
Okay, so like you said, the deep nasal swab is still most effective. And then when it comes to saliva or throat testing, that's more for children so that it's kind of comfortable for them, because it's harder to tolerate for young kids.
Exactly. It's more about preference. It's more about ease of being able to collect the sample. And, the recommendations in school are, if you have one new or worsening symptom, you should get tested. And so some children may be tested a few times even this fall. And so I think ensuring that the parents are not worried about the kind of tests they're getting to take them to get tested is pretty important.
Absolutely. And then this is our last mask question. PS asks, Does the mask depress or suppress the immune system?
There's no evidence that the mask depresses or suppresses the immune system, not at all. Healthcare providers, surgeons in the operating room, myself in an emergency room, we've been wearing masks. I've been wearing it for decades now. And the mask itself is not related among all the healthcare workers through all these decades that have worn them to immune suppression.
Okay. And then we actually just addressed this, but just in terms of a timeline, Michael asks, when will the saliva test be widely used as a test for COVID?
So again, more to come on that. It's being rolled out again in these 3 assessment centers, and it's going to be more available for children. And whether it will be more widely available is something that, you can see every week there is something new to talk about. And right. So hopefully we can say soon, because I think being able to have testing, either point of care testing or an easier way to collect it, you just drop it off to a lab, that's going to help us, because when you're feeling sick and you have symptoms, you can, if the quicker we can say it is or it isn't COVID, the more we'll be able to kind of adapt our activities accordingly.
Absolutely. And so these are 2 related questions coming in, once again, about groceries. One is from Elizabeth and the other from Anonymous. We keep hearing about sanitizing groceries or not sanitizing groceries. So what is the final word concerning the possibility of transmission from plastic bags and cardboard?
So you don't need to sanitize your groceries per se, like the groceries that you bring in. I think the bags or whatever that you bring it in, you can recognize that they may have been contaminated. And so the surfaces that you put them on to clean them, if you're using cloth bags to wash them, the most important thing, though, is that you wash your hands. We know that the virus can survive on surfaces, so, plastic, cardboard. Less often, they say something like a smooth, shiny stainless steel, it might be able to survive on that for longer. We're saying, up to 72, maybe 96 hours at the most, not often longer than that. And so, I think that, you don't need to be as concerned about contamination on those things. Really, the virus we're seeing is being spread from that close contact. And so this resurgence in cases we're seeing in the 20 to 39-year-olds, related to many of them spending time with other people who happen to be contagious at that time and not keeping that physical distance.
Right, absolutely. And then a related question, Rahik asks, does the virus spread through people's clothing?
There's no evidence right now that, if it's on my clothes and you touch it, if you're washing your hands, that's going to be fine. If you're talking about clothing, like buying secondhand clothing, well, we have actually guidelines on our website on how to shop safely secondhand. And really it's about, you can just launder that clothing, put it in your wash with soap, warm water if you can, put it in the dryer, and then you can be pretty confident that if there was any virus on it, that it's been gone.
Okay. And then this, again, another related question. D. Schreiber asks, why is a deep cleaning ever necessary, since, as you just said, the virus only stays alive on surfaces for about 3 days or so? Why not just shut down for those 3 days and then reopen and all the virus will be gone?
Yeah, it's interesting. We don't always actually recommend a deep clean because it's that routine cleaning. The virus actually doesn't live on surfaces that long. And we know that actually your routine household cleaners are pretty good at cleaning it. But I think when we know that, for example, there's a case in a workplace, then doing some enhanced cleaning to make sure that, those frequently touched surfaces were cleaned, they were cleaned properly, is definitely not a bad idea. But, this idea of kind of ripping up the carpet and cleaning, that's not the kind of cleaning that we're recommending for when a case is identified in a workplace or a school.
Okay. We've got a couple of symptom-related questions. Laura asks, if my kids show a symptom of COVID-19 like a runny nose, do I need to test them right away for it, or should I wait a little bit?
In order for them to go back to school, they need to be tested. And if the test is negative and their symptoms are getting better, they're improving within 24 hours, they can then return back to school. So again, these are the guidelines that we have to kind of keep schools safe. These guidelines may change. We may be a bit more flexible or not. It depends as we kind of understand more, learn more about what's going on. But right now, that is the guideline.
So no need to wait, just get tested.
You may as well just get tested because even if it resolves the fact that they had a symptom, like it was a true symptom and it was a COVID-19 symptom, then they would be home for 14 days. If, however, though, they were sick for other reasons, and you've spoken to your physician or nurse practitioner, they said, no, that tummy pain, actually it was because, constipation, your child has had constipation before. Well, that's a different story. And that in that situation, you don't need to get tested. You have an alternate diagnosis, and 24 hours after that symptom is improving, if you've spoken to your healthcare provider, you can send the child back to school.
Okay, and then we've got a question coming in right now from Jessica Ferguson. She asks, the tests give only 50% false positives. Is that a concern? Is that true? What is the rate of positivity versus false positivity?
So the test actually performs quite well. So we have sensitivity and specificity of the test, and they're actually quite high. Those are kind of our medical terms. The test, though, is dependent upon who is being tested. And so if you have someone who has symptoms and was a close contact of someone, the likelihood of them getting COVID, we call that the pre-test probability. Again, these are very medical terms. If that is high, well, then the likelihood of it being a false positive or a false negative is low. Like, it's likely to give you the true result. If, however, you're taking 10,000 people who never been tested, never been exposed, have no symptoms, and you test all of those, well, in that situation, the test characteristic may be different and it may not be as accurate.
Okay. So, I mean, there's a number of factors which we've talked about, I think, before as well. It just depends on, who's getting tested, when in the process they're getting tested. Is it 2 days before their symptoms started showing? Is it after their symptoms started? All of that kind of stuff.
Exactly. And I think it's important to note, though, that the testing guidelines have changed. So previously, if you wanted a test, if you felt like you were exposed, you could go and get tested, and that's not the case anymore. Because we have found in those situations, people just going to get tested, there were false positives, false negatives, like it was just not, and we're at a place where our testing capacity is quite high. So we actually really want people to get tested who are more likely to actually be positive with COVID. And so those would be people who have symptoms, have been exposed, that kind of thing.
Right. So actually then a related question on that, right now, Anne-Marie asks, can you get a test if you're traveling? Because right now we're talking about just getting symptomatic people tested, but asymptomatic and looking to travel.
So we know that some countries are requiring a COVID test for travel. There are 60 pharmacies or so that are offering testing in people who have no symptoms. And right now, travelers can go. They'll have to call and make an appointment to get tested in that way. I understand that may change in the future, but that's the case for right now.
Okay. And then there's a couple of questions about restrictions imposed on events. We've got only 1 minute left, so let me quickly ask this one. GTA Girl asks, why are Ontario casinos with up to 50 customers at a time permitted to reopen?
So that was part of stage 3 reopening. Casinos are actually quite large spaces. So as most of them can actually handle 50 people with physical distancing. Casinos were kind of in the same category as cinemas, as convention centers, but they were capped at 50 people indoors. And so if a casino cannot, with physical distancing, allow 50 people, then that is not going to be their maximum number. But as well, table stuff is not open. It's mostly just the slots. So that's another important point.
Okay, I think we have 1 minute left. 1 minute, and I'll quickly do this. What restrictions are imposed for event venues? Is the capacity still 50 people?
If the event venue is following the regulations in the Reopening Ontario Act, and that means the physical distancing, like all of the guidelines that we have, and following the law, the regulation, well, then they can have 50 people indoors and 100 people outdoors for gatherings, for events. Yes.
Okay. All right. Wonderful. On that note, it is 1 o'clock now. Thank you, Doctor, for answering all these questions. We had a ton of questions coming in live as well. We tried to get to as many as we could, but we will definitely put them on our list for next week. The doctor will be joining us again. So thank you, Doctor.
Okay, bye. Have a good day, everyone.
Thank you, everybody, for joining us.